Okay. Okay, welcome everyone. Thank you very much for joining. And this is Dr. Mustafa Musleh. I am PAMA, President of the Palestinian American Medical Association. I think most of the people here probably know PAMA. We are a 501c3 U.S. charity, and we're a medical humanitarian organization that aims to promote health and healthcare for the Palestinians. I have a great group of people with us today. We have 4 doctors who were just recently in Gaza, and we're going to hear about their experience, about the reflection, and what they can share with us. So we learn, all of us, about what's going on a little bit more there. And also this will be an interactive session as much as possible, of course. So feel free to send questions and raise your hands when it's time. You'll be given the opportunity to speak with our panelists. We have Dr. Adam Al-Hamawi. We have Dr. Jumana Al-Hinti, Dr. Muhammad Abdel Fattah, and Dr. Ghada Abu Quaik. And of course, we have my co-host here, Dr. Majdi Hamashi. He is the chairman of the board in PAMA. I want to welcome everyone. I want to just quickly give an overview about the medical missions and what we have done in the past, few months as PAMA. We have been sending medical teams to Gaza for years now, actually. We didn't start after the war. Last year, we sent 7 or 8, I think, medical teams, mainly surgical subspecialties. And then, of course, we had to stop for a period of time when the war started in Gaza because we were not allowed. We were one of the first teams to get in Gaza in January with a small team at that time. And since then, we have sent regularly, at least once or twice a month, medical missions, mainly surgical teams, complete with nursing and support staff. Just to give an idea about the impact, those doctors have managed and treated over 7,125 patients, and they've done over 1,000 surgeries. And we also, as part of that, we started a wound clinic in the European Gaza Hospital, which is still running and going with the local staff who were trained by those doctors. Besides treatment, they also have trained a lot of doctors. They did a lot of hands-on training, and they did a lot of educational sessions to increase the capacity of the local staff. I'm gonna leave the mic now to Dr. Hamashi, and then we'll have all our volunteers, our medical doctors, to go over, introduce themselves, and go over what they want to share with us today. Thank you very much.
Well, thank you, Dr. Mustafa. Again, my name is Majdi Hamashi. I'm the chair of the board of PAMA. I want to, on behalf of PAMA board, thank our panelists, our physicians, and our pharmacists, Ghada, and everyone who joined our medical mission. And also from this platform, I want to ask all the doctors who are not on this panel now and who joined already PAMA missions. As Dr. Mustafa mentioned, we have medical missions in January, February, March, and April. And now we are, and this mission was in May. We are working still with the WHO to get more medical missions into Gaza. Unfortunately, things are getting more difficult since Rafah crossing closed. Now, the medical missions changed significantly compared to before. Now, the convoy size is smaller, less frequent, and they are required to stay longer in Gaza. And delivery of medical supplies is very restricted. The team who is represented today by our panelists, they got about 300 suitcases with them into Gaza when they went in Gaza. Now, we are being told that we're only allowed to take 1 or 2 suitcases per mission member, which is very, very significant change. But we're gonna keep working to go to Gaza, and we will continue to go there, whatever venues are available. We are committed. PAMA is committed to Gaza, to Palestine. We've been there for 10 years, and we are here to stay as long as they need us. Without any further ado, I will move it to our panelists, and each of them will share with you where they are from the United States, and also what they have done in Gaza, and they might share a case they have encountered in Gaza as just a sample of what they have seen there. And then we'll open the platform for questions. With that, I will go ahead. Dr. Hamawi asked to be the last, so whoever is ready to go first, go ahead, introduce yourself from our panelists, and make sure you mention where you are from the US, and what you've done in Gaza, and then share your case. Ghada, I feel you are ready.
I would love, I don't mind to be the first. So first of all, thank you. It's really my honor to be here with everyone today. And I really had the privilege to be in Gaza in May. It was my dream to enter Gaza. I'm from Palestine, and originally, and I'm in New Jersey. I'm located in New Jersey. I own multiple pharmacies in New Jersey. And when the war started, I wanted to help, as everyone, I believe maybe everyone helped more than me. But I started to look how can I help Palestine. So I knew about the medical missions that started in January, and I said maybe the best thing, let me as a pharmacist, let me procure medications to the medical missions and send it to the doctors that they go to Gaza. So I started a nonprofit organization just for this only case to procure the medications. And I did that in New Jersey. It's a nonprofit organization in New Jersey. And I started to call organizations to be able to give them free medication that in Egypt to give it to the doctors to send to Gaza. And it was an honor to call PAMA and to speak with Dr. Mustafa, that I owe him everything in my life, that he make it happen for me to be able to go to Gaza. Whatever we're going to say, whoever went to Gaza, know that people say that Gaza is a city of ghosts. However, what we witnessed, it's a city of angels. And even though they have nothing in life, they have everything. And we have everything in US for us and for our families, but what we witnessed, that we have nothing, honestly. So it was really weird, logically, to say to a patient who's diabetic patient, that I'm sorry, I have no treatment for you. In US, anyone come to the pharmacy, if I don't have a medication, I will right away try to have a therapeutic equivalent and give it to him and search for anything to give it. I cannot let the patient go away with a prescription that he has to have to fill, and I will just let him go away without anything. There has to be something. There has to be any kind of equivalency. And when the first day when I went to Gaza, and this little boy, Habib, 8 years old, came and he needed the Lantus and Novolog for his 5 years old brother. And of course, none of his family is there. They are all killed. Istashhadu. This is the nice way they say it. And he doesn't have anything to give to his brother. It's the night shot, and he has to give him the Lantus and the Novolog. And truly, there was no Lantus and Novolog in the hospital. So I didn't understand this at the beginning. I didn't understand it, honestly. It's not logic. Alhamdulillah, we had 300 suitcases, mashallah, and I loved the Egyptian suitcases, the big one that you can put whatever you want. Inshallah, it will come back. And we had many medications with us and other surgical supplies. So alhamdulillah, we were able to give it to him. Like at end of our mission, after 3 weeks, there was no any kind of medication left. Most of them, it was out of stock, and also surgical supplies. So what I wanted to say that I worked in the inpatient pharmacy and in the outpatient pharmacy, and I had the privilege to organize the main store of a hospital. But also another thing, a hospital that it's the hub for more than 30,000. You treat 30,000 people around you. And there are at the beginning there were tents in the hospital and tents around the hospital and the school, and And all these people, they had to get medications through this place. And you only have two pharmacies, okay? And the store that you think it's going to be huge, you only see a small room with 4 aisles that has medication for all this 30,000 people. So the inpatient pharmacy, OR rooms, emergency ICU wards, send orders to the inpatient pharmacy to get the vials, cardiovascular, painkiller, name it. And it was very normal in Gaza to say, we don't have it. So at the beginning, when the pharmacy will send back the basket, this is the way they use it. They send baskets back to the ward, to the OR room, operation room. They don't have phenylephrine. They don't have they don't have vials that essential to do the operation surgery. It was very normal for them to do that. Then the outpatient pharmacy people.
God, I want to give you 1 minute to conclude.
Sure. So that was really something يعني very hard for me to operate and to even when I started to tell the people to get some kind of plant remedies, counseling them, kind of because there is no medications available, even the plant remedies that you will be able to use for your treatment, it's not available. So, but we believe with all the resilience that they have and all the strength that they have, that they will make it, and they are making it, by the way. And we are so proud to be part of all the medical mission. And inshallah, hopefully, the first medical mission going to be back, we're going to be the first one to go there. We promise them to be there with them, and we will be there, inshallah.
Okay, who want to go next? Jumana, you feel you want to go next? The ladies first.
I can.
Go ahead.
I'm Jumana Al-Hinti. I'm a neurologist. I work in Toledo, Ohio. I'm a mother of 6 beautiful kids. They are all fighting for Gaza, alhamdulillah. I was blessed by Allah subhanahu wa ta'ala to go on the PAMA mission in May. And I believe that is a huge blessing and something that I don't even deserve. It was amazing. And I want to thank PAMA for all their work because they're doing an amazing job, mashallah. So as I said, I'm a neurologist. I tried to go to Gaza from the beginning, from October. I signed up for all the missions and everywhere and talked to PAMA before, but they said, you're a neurologist, you're not needed yet. And finally, alhamdulillah, after a few months, I reached out again, and Dr. Nizam Turk, I'll give him all the credit because he put a good word for me, and alhamdulillah, I was able to go. And as you can tell, neurologist, so I don't do trauma, I don't do all the surgeries, and I'm not anesthesiologist, any of that stuff. And so from before I went, I was trying to think, so how am I going to be helpful? I said, I'll do anything, I'll transfer patients, whatever they need me to do. If they say you're a neurologist, you're not needed. But when I went there, I discovered that, okay, I was the only neurologist in the whole area, the whole hospital, and even around it. There was one other neurologist who doesn't work regularly. And the need is unbelievable. So when I first started working, I started working in the ER first until I spoke to the administration in the neurology clinic that was open while I was there. And while I was in the neurology clinic, I was shadowed by 2 beautiful people, very smart, very intelligent, Dr. Ala Al-Masri and Dr. Nabil. He's a 5th-year medical student, and Dr. Ala is an intern. And I tried my best to teach them as much as I can with all the time that we had. And they're actually carrying the message now. They're doing the neuro work in the hospital now. So I wanted to share a few cases really fast. Can I share my screen?
Yeah, let me see here give me a second. I'll work on it.
Okay. So the first case, as I said, well, we were asked to see if there are cases that because of lack of resources, they died or something bad happened to them.
Dr. Zamana, you should be able to share your screen. If you have a problem, let me know.
Wait, it says it's disabled still.
Okay, let me see here. Want to try now?
Yeah. And So the first thing I wanted to share with you. So I'm not gonna put the noise on. So this is a kid that we saw in the ER, the triage area. He has cerebral palsy, and his father told us that before the war, he was able to crawl and talk. And since the war started, actually their house was bombed and he was found under the rubble. He was still alive under the rubble. And after that, his case deteriorated so fast. They don't have any medicine for him. He used to take baclofen for, you know, the spasticity, and no physical therapy, no occupational therapy, no, you know, education, special education, no nothing. And he developed diarrhea and nobody knows why. And so he doesn't eat much. And as you can see in the video, it's totally emaciated, like bone and skin. He came to the ER just to get some IV fluids and nobody knows why he has that diarrhea. You can't really look him up. So the family is devastated and they're saying that they don't want to lose him. They lost a daughter already. And as you can see, he's just bone and skin. So this is one of the cases that really hit me so hard because that would never happen in America, right? You can't have a CP patient to deteriorate that fast and do nothing for them. They have no resources whatsoever. Cases of autism that I saw in the clinic where the parents would have to tie their kids in the tent so they don't lose them because they wander around, they run around and you don't know where they're going to get to. Another case where he started becoming aggressive because of the war and he's hitting everybody and pulling some people's hair that they can't get the hair out of his hands. So his dad is tying him down in the tent. All these cases just like, and you stand there, your hands are tied, you have nothing to offer them. Other things that I wanted to talk about, and they're extremely
I might give you 1 minute to conclude, like share whatever you can in 1 minute.
important. It's the psychological impact on everybody there, not just the patients, but also the staffers, the healthcare workers. I spent most of my nights talking to the nurses and doctors, and we had halaqas and we did a lot of stuff, and they told me their stories, and those stuck with me. I would cry every night because of their stories. They've been displaced so many times. They've been tortured, taken away, tortured. They don't know where, for a while, they didn't know where their families were. And still they came to the European hospital and they're volunteering, not getting paid. And those are superheroes. Those are the superheroes of the world. And I am blessed to know them, I know each one of them. And I'm glad that at least I left something behind, someone who's carrying the work, Dr. Nabila and Dr. Ala, and thank you.
Thank you. Dr. Abdel Fattah, go ahead.
Hello, everyone. My name is Dr. Mohammed Abdel Fattah. I'm an ICU physician from Southern California. Pleasure to be here. I wanted to again thank PAMA for all their efforts in allowing us to get to Gaza for this incredible experience. Thank my colleagues, Dr. Jamana and Ghada, and Dr. Adam. They were all amazing. I saw Dr. Jamana coming in late in the evenings, 1, 2 a.m., spending the whole day out being useful. Same with Dr. Ghada. I saw her all over the hospital. So mashallah, they were doing amazing work. As far as my personal experience, I just wanted to highlight, I would say, the children of Gaza. You know, before we went, the head of UNRWA said that this is a war on children, and that's absolutely what we saw. When you pull up to the hospital, the very first moments that we got there, we were bombarded by all types of kids, young ages, 4, 6 to 10, happy to see us, smiling, many of them with bare feet, no shoes at all, rugged clothes with holes in them. You can tell they haven't bathed in weeks. And so, you know, the kids, and even the malnutrition, you can see how thin they were. And this is just the kids outside the hospital. So my first day, I went into the ER there. And as I walked into the ER just to see what capabilities the hospital had, I immediately saw 2 kids, one about 3 years old, the age of my son, with his arm up in the air, just screaming in pain. And he had a severe burn on his forearm and his skin was peeling off. And he was trying to be consoled by his mother. And right next to him was a 6-month-old girl whose foot had a huge laceration, and you could see the muscle layers on her foot, and she was screaming, crying. And so these were the very first cases that I saw in the hospital, and was the trend that I was going to see for my remaining time. So, as an ICU doctor, I work in the ICU, and I'm used to treating adult patients, but in EGH, every adult patient, you'll find 2-3 kids next to him in the ICU with severe explosive injuries, shrapnel all over their bodies, amputations, severe burns, with dressings weeping that haven't been changed in a few days. There was a really significant fly problem in the ICU. Despite all the efforts to get rid of these flies, you had flies throughout the ICU landing on these wounds and causing infections. The hospital staff in the ICU, they don't have hand soap to wash their hands. They don't have hand sanitizer. And so infection is spreading like crazy. And so, as intensivists, we want to stabilize patients. And we were doing that initially, but you would see after a few days, they would succumb to their wounds from infection. And so it was very frustrating. And so that is what I wanted to share initially. I have just a few pictures, if I could share my screen. Please.
You should
be able to. I'll share screen. Let's see. Okay. You can see that. So this is a child in the ICU, a burn victim, and here's just some video. I want you to pay attention to the alarms. So the sensors, the ventilators on the monitors, they're all faulty. So the alarms are constantly ringing in the ICU. Also want you to pay attention to the flies. And so infection control is very difficult. This is a young boy, severe burns. As you can see, the dressings are all saturated, and he didn't survive. Another young child here, severe burns. You can see there's no sheets on the bed. They don't have sheets on their ICU beds. This was also a very difficult case. This is a 9-year-old whose home was bombed right next to the hospital in Khan Yunis. 4 of her siblings were killed, and she came in with severe explosive injuries. We tried to stabilize her for maybe about an hour, and eventually did, and then took her to the CT scanner to see how severe her wounds were, and her heart stopped. She went to cardiac arrest and passed. And I just remember seeing her fingers and painted fingernails, and just seeing, these are just regular kids that had bright futures taken away from them. And then this is Raed, our ICU nurse, who was making makeshift socks in the ICU for one of the kids. So it was a nice photo that I was hoping to end with. Appreciate all of your time.
Thank you, Dr. Abdel Fattah. Dr. Hamawi, you're next.
Yeah, thank you very much for again having us and holding this forum. I'm Dr. Adam Hamawi. I'm from Princeton, New Jersey. I'm a plastic surgeon, and it's we before we had this conversation, we were talking about each of us having 5 minutes, and I stated, please hold it to us, because as you could see, all of us have, if you left us to talk, each of us could talk by ourselves for hours. And we're supposed to talk about like one patient where had we had the resources, we would have been able to help them. And I can't think of one patient that we could not have done better if we had the resources, because even our best case was not up to the standards of what we could have done here in one of our hospitals just a few minutes away. So every patient there is receiving less than what others could be receiving. And despite everything that we've done and all our abilities, because as healthcare professionals, as doctors, as nurses, we rely on everyone around us and everything around us, including the medical equipment, the technology, even the nutrition that we just talked about makes a difference. So it's a completely different world there. And the thing that makes it special is the people and how they are handling it despite all of this. You know, for one example, for me is a 1-year-old child that was came in with a burn that covered about 40% of her body from an explosion, and it's an extensive burn, but this would have been handled very easily here in the United States. I mean, she would have been in the ICU for a while, she would have received care, but she would have left the hospital. She didn't make it past two days there. So, and you know, this is all the patients that we're seeing. Everyone is getting either not making it or having outcomes that are much less desirable than what we could be providing had they had, you know, open, you know, supply chains for medical personnel, nurses. I mean, we keep talking about doctors. For every one of the doctors, we need 5 nurses, and there's very little nursing care over there. And the ones that are working there are overworked and don't have or don't have the education. Many nursing students there as well. I work with a lot of medical students. So that's the situation there. And the one thing I would say is that this sounds very ominous, but everyone does what they can, and we did what we can, and we do make a difference. And it just makes us strive harder to try to do more. So this shouldn't be like, oh, this is hopeless. The people in Gaza do not see this as hopeless. They continue to come to work. They continue to struggle. They continue to live. They continue to be generous. They continue to smile. And we owe them to do everything we can to help them.
Thank you, Dr. Hamawi. Thank you very much. So we started to have questions coming in on the chat. I mean, me and Dr. Mustafa are trying to answer them, but I'm gonna say some of them, mention some of them to the group here. Like one question is about some medications need special temperature. This may be to Ghada, like to be refrigerated or saved in a certain way. How is that being managed? Both through transporting it to Gaza, like from Egypt, and also keeping it safely in Gaza, and that might apply to the insulin case you mentioned, Dr. Ghada. Can you?
That was actually the main blessing that I had in this trip, that I was able to get more than 1,500 insulin pen. We had with us the fridge kind of, you know, the one that we take it with us in the trips, that thingy. We had 5 of them with us in PAMA, and we had the ice in it, and we had the insulin. We took off the insulin packet, and we only had the pen. And also the albumin and the IVIG, which actually was not available at all in the European Gaza Hospital. And in our trip with PAMA, we had, I don't know how many hundreds, we had albumin and we had IVIG. The same thing, I took it off the boxes, and I just wrap it with a little bit of a plastic thingy, and I put them in those kind of big ice pack, you can say it, bags, box, or it, yeah. Cooler, yes, the cooler. Thank you. So we had them, and in right away when we reached out to the Gaza, because we left at 4 a.m. So from 4 a.m. till Maghrib, it's in the cooler, so it was fine. And then right away, the same day, I put them. There is the main storage in the hospital. It's a big kind of a fridge. I put them over there, and it was fine. So that was the way that we had so many of unavailable items.
How creative you were to partially solve the problem for part of the time for part of the people in Gaza. But this speaks volumes to that what's going on now. And we might not have more people going in doing what you did. And we only went to European Hospital to help some patients, did not help everyone in European or in Rafah. Well, how about Khan Yunis? How about North Gaza? How about Middle Gaza? How about after you left, who else is there? So this is a big problem. availability of medications and resources in Gaza. Big problem. I want to, Dr. Abdel Fattah, you worked in the ICU. I'm an ICU doctor. I'm planning to go, inshallah, end of June. I'm being told if you don't bring supplies with you, you are welcome, come in, but you might not be as useful. So, and they are speaking big things like vasopressors. These are medications to keep the blood pressure where it needs to be. Sedation, where to keep the patients compliant with the ventilators and not to pull the tube out and to be able to oxygenate them. Antibiotics and basic needs. Without them, you cannot do an ICU work. Catheters. Can you speak to that? What was the shortage, Dr. Abdel Fattah?
Yeah, I mean, there are shortages everywhere. Supplies, even saline flushes. We would have to go draw them up ourselves. There's not enough staff to help to set up the infusion pumps. We're calculating the doses of the pressors. You're doing every part of the ICU. You're setting up suction. You're setting up the ventilator. You're finding the mask for the ventilator. And they have supplies, but they're not organized. So it's hard to find the supplies, and they're extremely limited on supplies. In addition to the supply shortages are the obtaining information. As an ICU doctor, you want to get vitals, you want to get labs, you want to get imaging. All of that is so difficult. They're paper charts. Sometimes they're updated with handwritten labs. Other times they're not. So it's hard to get a sense of what the patient is being treated with antibiotic-wise or what his course looks like because there's no daily notes. So as an ICU physician, it's very frustrating. And as some of my colleagues have mentioned, you are going to learn from them. I was hoping to sort of support them and maybe teach them some things, specifically ultrasound, but they taught me so much. And they're such pros, they're so skilled, they're 8 months into this. And so they're managing these complex cases like professionals. So I wouldn't worry about not having the skills or resources because you will be useful and they'll show you how to be useful.
And the tragedy is this is a man-made shortage and crisis. Like the trucks are lined up 7 hours from you at Rafah crossing. If they just open it and people will live, people will do well. The IVIG case, Dr. Jumana, I heard that Guillain-Barré syndrome case. This is a neurological condition. They need IVIG in the IV, and they will just go home. But patient was on the ventilator day after day, and did not make it. Can you shed the light on cases like that?
Well, yeah, this case, Guillain-Barré syndrome, came in, and I was very impressed with the interns, actually, the Gaza interns. One of them, actually, she diagnosed her on the spot, and she said, this just must be Guillain-Barré. And then they called me, I saw the patient on the wards. Just like she said, it was Guillain-Barré. The first couple of days she was okay on the wards, although because of her inability to swallow and cough, like it was starting to get affected, and I told him she will end up in the ICU, and she did, and finally she got intubated. The struggle that her husband went through he was a doctor, and that was a blessing for her because he knew how to handle things. But the struggle he went through to get her IVIG was tremendous. And finally, he got her all the doses. And thankfully, actually, she was extubated and she was transferred to the ward. I visited her before I left on the wards. And I asked my intern to go and visit her later. And he said she was doing fine. And the day after, she was actually discharged. But now I'm scared for her because what kind of physical therapy she's gonna get in a tent. How is she gonna continue her improvement? And that's really a scary thought for her.
Dr. Mustafa, you want to take the mic now?
Yeah. Thank you very much, everyone, Jumana and everyone. I just want to answer a couple of questions because they've been a very recurring questions. So the one that we get multiple times is, I signed up to the medical mission and we signed up 3 times, but we didn't, get replies when we're going. And yes, we would love to take everyone, of course. And at the meantime, we have probably close to 2,500, volunteer list that signed up. And we send teams there. So we build those teams around the needs for the hospitals, and those are different every time we go. Different. We try to collaborate with some other organizations to prevent repetitive and multiple people going from the same specialty. But I think we will probably not be able to get everyone on that list. If you signed up, we'll have your name. I think we will probably maybe consider doing maybe some updates that we just got your name, and we are building again the teams again based on the needs in Gaza, and that may change every time and then. We have a question that I'm a dentist, can I go or different specialties? And yes, it may be different each time. We build a mission that if the place requires dentist and we have space, so we always have to prioritize a lot of things, but there is need for everything. We may not be able to take everyone, but there's a need for everything. So I encourage you to sign up for that. We'll try to put that link in the chat so everyone can click on it and sign up, and we'll probably get some updates. One question that I want to leave to Dr. Hamawi to answer is there's a question: what is the mood or attitude of your colleagues, doctors at the hospitals you volunteered in is like? Can you share with us how is the general feel and what's the doctor's sense of what's going on and what's their status of well-being and everything?
So the Palestinian doctors that we worked with, I'm going to say their mood is much better than ours. Like we're all sitting here talking, we're very solemn. We hear these stories and it brings us down, and we're often brought to tears. The first thing you notice when you get to Gaza is that everyone smiles, and you're greeted off the bus with smiles, and you leave and you say your goodbye with your smiles, and every day you come to work, and almost everyone is smiling. They go through some hardships. Every single one of us knows someone at the hospital who, while we were there, had someone in their family that was injured or killed, because it happens every day. And the nurse that I met the first day, like 3 days later, he had cousins that were killed and people that were in the emergency room. They take that, of course, they're like, and they come back to work and smile. And so this spread to us, this hope, this work ethic, this reliance on you have to work and deal with what you've been given, and this acceptance of that is something that we, I think all, and I'm talking about we is the doctors and nurses that went there, benefited and learned from that. And so while we were going there to try to teach them, and bring some education, and we brought some of this didactic stuff and our quote modern medicine and everything, but they had this before. They had access to this. It's not like they're in the Stone Age. I mean, this is just something that's being inflicted upon them. And I think we came out of it with a lot more than we brought in. And so that's the mood. I think our mood coming out is better and stronger. Their mood is amazing with what they're going through, and it's something that we could all benefit from.
Dr. Mustafa, I'm going to allow people who raise their hands to ask questions. I'm going to start with Hanan. Hanan, go ahead, unmute yourself and ask your question.
Assalamu alaikum.
Alaikum salam.
I'm Hanan Said, my pediatric surgeon. I just left Gaza on the 1st of May. I was there with BCRF. Actually, as you said, every one of you, they need everything, but we managed to get what I did, because I know I'm going to European Hospital. I did ask them what they need, and according to the need, we got everything they needed for at least 3 months. And as your colleagues, the pharmacist said, you don't have systems, so we have to help them to put this medication organized so they can use it properly. Again, they need everyone and everything. So hopefully Rafah will be open, because going Gaza through Jordan is only 2 bags for each doctor or less. I don't know how you can fix this problem. If you can try to allow the doctor to take more, it would be great, because as your colleague said, if you go without an instrument. Last time I have also to get my sutures as a pediatric surgeon. So I hope these measures be for everyone. If you can get more and more stuff, you will help more the people. And I don't think we can help everyone. We just do at least what we can do. Thank you.
Thank you, Dr. Hanan. I want to say to everyone, like that was also a question. There is a big difference between Karim Abu Salim crossing and Rafah crossing. At Rafah crossing, they were very permissive to how many suitcases and medical supplies we can take to Gaza. 19 mission members got into Gaza May 1st. They got about 300 suitcases with them, full of medical supplies. And that sufficed them to work and be productive for a week or two before the supplies run out, because the demand is high. But now in Karim Abu Salim, they are asking us to only bring 2 suitcases, and the list of allowed items are only personal items. So I don't know, this is very, very limiting. I don't know how WHO is negotiating this with Karim Abu Salim officials, but this is unacceptable. I'm gonna give the mic next to Adil Chowdhury. Yes.
Can I point out
yes,
something with that, because it's very
yes.
important, and this is where yeah. So this is where if we have like 150 or 200 people on this phone call, this is where when everyone says, "Well, what could I do?" This is something that we could try to do. I mean, this is something that is completely unacceptable, is to have this limitation on medicines and medical supplies. And this is when we all need to be talking to our representatives, our senators, our congressmen. You know, every one of us has a voice. And while we feel that we are unable to do something, that we have overwhelming odds that it's not going to make a difference, for us to do that is minimal to what the Palestinians are doing. I mean, they're facing overwhelming odds as well. And the least we could do is to keep raising our voices and say, this is a situation, only 2 bags of personal medicines are being allowed. They need medicines and they need humanitarian aid. And this is something every single one of you on this phone call can be doing. So it's not just doctors and nurses that they need. You know, they need the support of the international community, which is everyone.
Thank you, Dr. Hamawi. Now I'm gonna go to Adil Chowdhury. Go ahead, unmute yourself and ask your question. Make sure to unmute yourself.
Can you hear me? Assalamu alaikum.
Yes, go ahead.
My name is Adil Chaudhry. I'm a gastroenterologist in Fort Worth, Texas. And I was wondering if there is any need for somebody like me who doesn't know how to stitch or, you know, take care of wounds, but want to know, is there any way I can be of service to the people in Gaza?
Dr. Mustafa or Dr. Hamawi, you want to take that? Dr. Mustafa is a gastroenterologist like you.
Yes, I will take that. Yes, and there's actually need for everything. There's, you know, a couple of months ago, there were some communication that there are needs for gastroenterologists. Again, we depends on the location we go to. That's sometimes the limiting steps. So some we have in the European Gaza Hospital where we sent our teams. We try to keep our teams together because of logistics and difficulties of having multiple team members in different places. But they didn't have, for example, obstetric. You know, we had a lot of gynecologists who wanted to go. We have, but if you apply to the I'm going to share the link here shortly in the questions and answers. I'm sorry, in the chat form. And that will be like our database that we collect. And if we need gastroenterologists, we will reach out to the gastroenterologists on that list.
So just, there was a gastroenterologist with the other team that came with us while we were there. So we were there with several other organizations. And one of them was a gastroenterologist. He came with his own scope. He was very, very busy the whole time, especially doing things like ERCPs and work closely with our general surgeon. So, you know, just like stated before, every specialty is needed. You might have to bring your own instrument. So he came in, like I said, with his own scope. We had, like, you know, a lot of the ICU doctors brought their own bronchoscopes with them and, you know, and worked with that. So you have to anticipate what you're good at, what your need, and the instruments, and try to bring them with you. And with the current restrictions, that might be a little bit more difficult. But I think, again, if you could get it into one suitcase and say, this is mine, and I'm bringing it in and bringing it out, that might be able to be something that you could pass through.
Thank you, Dr.
I
Hamawi.
want to read one of the questions to Dr. Abdel Fattah real quick. What is the availability of blood products in the hospital there?
So I didn't sense a shortage while we were there. I did see a lot of our staff donating upstairs in our group and other organizations. There was a general sort of limiting sense as far as resources goes. Like if it, there was this term that the ICU physicians, the local ICU physicians use called the hopeless case. So if someone came in very severely wounded, they did, particularly try to avoid using excessive resources, knowing that the mortality was just so high. So as ICU doctors trained in America, that was hard for us. I know, we want to do everything that we can to resuscitate these patients. So first couple of days, there was kind of a culture shock in that we had to listen to our colleagues who have been seeing this for 8 months and sort of know when to hold back. And the times that we tried to be aggressive in patients they labeled as a hopeless case, they were right. Like the patient did not survive. So they have the wisdom, they have the knowledge, the expertise now. And so we follow their lead. And so there are general sort of resource limitations.
Dr. Abdel Fattah and others, if you can comment on the availability of radiology capabilities in Gaza. I was hearing that there's one MRI machine in the whole strip, Dr. Jumana, if it's working at all, and a few CAT scans. What do you think?
As I know, there's only this CAT scan at the European Hospital, and it has an artifact in it. So all CT scans have this big hole and like little rings around it. So that's, as far as I know, there is no MRI. We couldn't get an MRI in any of our patients. I had a patient with cervical myelopathy, very obvious, and then we got a CT scan. It's horrible. And yeah, you can't get an MRI. So
there's no MRI machine. There's only a CT scanner. There are portable X-rays. There's a portable X-ray machine. Transportation is very difficult to get these patients to the CAT scan. So difficult, especially maneuvering throughout the halls. There were families everywhere in the halls. So, and we had a patient that almost coded, the pressure ran out, the oxygen ran out. So it's risky to get CT scans, and it's difficult to get reads. There's one radiologist on site, but majority of the times they're looking to us to read their images for them. So, yeah, CT scans are available, just difficult and risky at times for ICU patients.
And another thing is that the electricity kept cutting off. And so when it does, that CT scan goes off for like 30 minutes. So you have to reboot. We had one trauma case that I worked with, and there were two little, a baby and a kid. And we had to wait 30 minutes for the baby to be scanned. And then the kid, and it turns out they brought the kid later, and he was severely injured. And he was delayed like an hour. He was bleeding into his internally. So that huge delay was because of the electricity cutting off and the whole CT scan shutting off.
Amazing. So I think we're gonna go beyond 2 for sure. I have 10 people raising their hands to ask questions. We have 50 questions we're trying to catch up with me and Mustafa. So there's eye care at rebuilding. I'm gonna allow you to talk. Please unmute yourself and ask.
Yes, thanks for this. Thanks for the speakers. I'm Townsend Cock. I'm the medical advocacy coordinator for Rebuilding Alliance. We're a aid NGO that works in Gaza. My question is, one of our things that we've been pressing for in our congressional advocacy is more medical evacuations to make that possible. But because the WHO estimates that over 14,000 need to get medically evacuated. But what do you see about the sort of the benefits of pushing that versus pushing more medical missions getting in and more supplies? Could you talk about how to balance those two? Because a lot of care simply can't be administered in Gaza at this point. So how to balance that?
Dr. Hamawi, you want to take that? The balance between, if we have to choose, or we should do both, I think, evacuate some patients. But what do you think, Dr. Hamawi?
I mean, it's really based on resources. I mean, there's certain things that no matter what we do, it's going to be very difficult to bring it into Gaza. Some of the complex care that requires like a multidisciplinary team or really advanced therapy, those are ideal to kind of try to get them out of Gaza as soon as possible. But you know that's not going to work for a majority of the population. So we have to try to bring in as much resources and you know think of it as like a you know right now how we would think of tertiary centers is like what would you refer out even if you were here in like the United States and sent to like you know Memorial Sloan Kettering or MD Anderson or that type of care is still going to need you know highly specialized treatment and right now we're not even able to get them out you know since the borders closed. There were people who were given clearance to go to have treatment outside of Gaza and they can't. So we need to open that for them and facilitate those who need to go out for advanced treatment and really work in to try to rebuild that whole healthcare system to at least provide the basic care.
Thank you, Dr. Hamawi. Omar Saab, please unmute yourself and ask your question.
Assalamu alaikum. Thank you very much for the great talk. Jazakumullah khair. I'm Omar, one of the academic hospitalists, Cleveland Clinic. My question is, what can we do if somebody cannot go in person to help people there? Can we participate in medical education virtually? And is there like a way for donation? We can like donate money for people to buy supplies and deliver it to people in Gaza. And thank you very much.
Dr. Mustafa, you want to take that?
Yes, absolutely. Yes, you can help by first spreading the word, do advocacy. A lot of advocacy is needed, reaching out to your state representatives, senators, and the Congress to push for our asks are mainly providing humanitarian aid, ceasefire, and allowing medical teams to go in and out, and allowing all kind of humanitarian support, unlimited, to be delivered to at least help as many people as possible on the short term. I think donation, yes, I would recommend generously donating to trustworthy organizations that you trust. We will share our link for donation to Gaza Medical Mission here in this group here shortly. And there's also other organizations that you can support as well. I just recommend you do your due diligence and you support to people who you trust. A lot of people are doing good work, and we appreciate the financial support as well.
Thank you, Dr. Mustafa. Now, An'am Fatima, please unmute yourself. And Dr. Jumani, before An'am, go ahead.
That's one more thing, because a lot of people ask, like we feel hopeless and what can we do? Even going on a protest in the street, that's amazing. That's a very important thing to do. People are being aware, they're learning. We distribute flyers to teach them about what's going on, and that have changed a lot of hearts here, like especially in Toledo. I live in Toledo, so we've seen the difference over the 8 months. So go on go protest, go talk to representatives like Dr. Muslih said. Don't just sit and say, I don't know what to do. There are a lot of things to do.
And also, Ghada, you want to also weigh in? You're doing great work reaching out to your representatives. What people can do, you might also guide people what they can do given what you are trying to do.
Actually, you can do many, many, many things. Yesterday, we had in Clifton, I'm in New Jersey, we had the flag raising in Clifton, and actually I was talking for every day. I'm doing more than 2 interviews. I sent a letter to the senator regarding the humanitarian relief and aid that has to go to Gaza. We sent some cases, even if you don't have cases, but actually, you know the situation, you know that in any war in the world, there has to be a kind of healthcare providers to aid, to help people, and just sending those kind of letters to the senators, to the representative, to the legislation. This is really very important. There are so many things that you can do, either calling the even the radio, the TV, letters, websites, educating the people around you. You don't need to be part of any medical mission, but just educating people and letting them know about what's going on. It's a lot of things that we can do. Please feel free to connect with us. We can even send you some resources and some stuff that we are doing, and you can share those things with us, with your representative in any state you have. But there are so many things that we can do, and please feel free to reach to all of us. I believe all of my colleagues in this mission, they are doing amazing job calling different kind of radio and TVs channels and mentioning what we are doing.
Thank you, Ghada. Thank you, Dr. Ghada. An'am, you wanna go ahead, unmute yourself and ask your question?
Hi there.
Hi, go ahead.
Hi. Thank you so much for all your efforts. I really appreciate that. I am like the resident first year family medicine in Canada. So is it something like I can join the organization, put my name in the team, or like can be beneficial, can go there? And the other thing is obviously I'm from Pakistan, so I don't speak Arabic. So we're still helpful there, no? So thank you so
Yeah,
much.
so yeah, Arabic is not it's a addition, it's a plus, but it's not a must. People in Gaza, especially healthcare workers, they speak good English and they can communicate with you. Now we would love to take trainees to Gaza and like residents, and what now at the current point in time we are prioritizing it to the people with expertise, with experience. The situation is very complicated. Even like expert surgeons like Dr. Hamawi or clinicians like Dr. Jumana or Dr. Abdel Fattah or Dr. Ghada, they are saying what we are seeing in Gaza we have not seen in our career, like the volume, the complexity. So while trainees are going to be helpful, but we have limited number of mission members that we can send every time. So we are prioritizing it to experts in their fields and clinicians. But we would love to take your name and email, and I'm sure at one point in time we will need you, but not at this point in time. That's PAMA's policy. But other medical missions, they might take residents with them, but in PAMA we have not been doing this yet.
Thank you so much. I appreciate it.
Yeah, you're welcome. Next, Aziz Rahman. Aziz, go ahead. Azizul? Let me see. Azizul, yeah, you can unmute yourself and talk.
Assalamu alaikum. Can you hear me?
Yes, we hear you.
Yes. Jazakallah khair. Yeah, so I'm interventional radiology. I think you kind of answered the radiology question. I guess to top that, I was wondering if there's an opportunity to set up like a teleradiology service when services do get set up. And then secondly, as a vascular interventional radiologist, if there are C-arm machines that could be utilized or ultrasound guided procedures that would be useful if we could bring our own ultrasound, for example.
We're talking about, like, we've been in the European hospital, our team. I know they have a cath lab with C-arm. I know we've been looking to send one of our interventional cardiologists to go there, and I know they share the cath lab with IR. I'm gonna ask like one of our mission members if they have more detailed info. And I want to say at this point, we have established an interventional radiology suite in a Shifa hospital in North Gaza. We opened it last July 2023. It's a $1 million investment, and I've been there myself, but unfortunately it has been destroyed like everything in a Shifa hospital. So we've been investing in interventional radiology in Gaza. But currently, I'm gonna ask my panelists here if they know anything about that.
I mean,
yeah.
Sorry, specifically, I could talk about the radiology services. I know in the ICU, as I mentioned, we only have there was only one radiologist on site who was reading images if we needed a report or a second read. So some of the ICU doctors reached out to me and asked if there are available radiologists that we can try tele services where they can send images via WhatsApp. So that I reached out to some of my colleagues here. If you're interested, I can get you connected as well, just for second reads, or if that radiologist is not available, at least they could reach out to you guys. So if you're interested, I will get your contact and reach out to you.
Thank you, Dr. Abdel Fattah. Now, anyone, before I give the phone to the next speaker who is going to ask a question, anyone want to add anything? Okay. Hamza Miltaha, go ahead and unmute yourself and ask your question.
Assalamu alaikum. My question is, as a neonatologist, are there any functioning or partially functioning NICUs, and where are they located in the strip mostly?
Any of the panelists know about our NICU? I know like the Emirati hospital has the NICU mainly in the south part of Rafah. And I know in the north part there was Kamal Adwan and the Shifa in the north part of Gaza. I'm not sure about Nasser. It has NICU, but Nasser was again destroyed and evacuated. They're trying to rebuild it and reopen it. Shifa hospital is completely destroyed. European hospital did not have NICU in it. The Emirati hospital had one. But anyone from the panelists want to add to that info? That might not be very accurate.
I have a colleague from Dallas. He's a neonatologist who went to Shuhada Al-Aqsa Hospital. There's a NICU there. I think very small. He was there a few months ago. Yeah, we just have a PICU at each GH, but the only NICU that I'm aware of is at Shuhada Al-Aqsa Hospital.
Thank you, Dr. Abdel Fattah. Thank you. Ihtisham Haq, go ahead, unmute yourself and ask your question.
Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Ihtisham Shami. I'm the pharmacist by profession in the state of Texas. I know there's been a lot of problems and shortage of drugs. So I've worked with some pharmaceutical companies. So is there any way that the pharmaceutical companies are providing some drug samples that will overcome the shortages of drugs in Gaza or wherever it's needed?
Sure. Dr. Ghada, you want to take that? What you know about that?
That would be great. We would love to get as much as you can. I know that nowadays it's going to be a little bit kind of, with the logistics, going to be a little bit hard, but please, any pharmaceutical companies that they would like to donate any medications, samples, anything, please, there are some stores available in US that we can get all those kind of medications, and we can send it to Gaza with the logistics with PAMA. So feel free, I can give you my email and my information, and we can get as many as you can send.
All right, thank you so much.
Open the door.
Okay, I have iPhone 37. I'm not sure who's that, but I'm gonna open the mic for you. Please go ahead and ask your question.
Hello, my name is Nabil. I'm a registered nurse here in Boston, and I just heard the question about the cath lab and IR. I'm an ICU nurse. I currently been working in the cath lab and IR and neuro IR, and I was wondering if you guys need for this specific specialty. I've already applied as a volunteer, and I didn't hear back from you guys. But I was just interested with the IR and the cath lab if there is any need for nurses with experience in moderate sedation, scrubbing, and circulating. I'll be happy to help.
I mean, I would say yes. And what again, we always try to send our physicians with their or I want to say it, we would like to send a complete team. Like Dr. Hamawi was talking to me the other day. When we go to the OR, we want to do like an anesthesia surgeon, OR nurse, OR tech, and recovery room nurse. The ICU and intensivist and ICU nurses, ED and ED doctor and ED nurses. The same applies for the cath lab. We under our IR specialists here, they are heavily reliant on their support team, including IR nurses. Yes, that would be perfect, and we will need your expertise. Please make sure you sign up for our missions database, and we are very hopeful that things will open up again and we can send more people to Gaza. But at this point in time, that Karam Abu Salim thing is very, very oppressive, very restrictive, and is not encouraging at all. When the need is at its peak in Gaza, they are restricting access to humanitarian aid significantly. But yes, we need you. Thank you.
Thank you so much.
Sure. Honar Ali, I'm gonna open your mic.
Good evening, everyone, and thank you for your service. I am from Iraq. I'm orthopedic with 8 years working experience, including 4 years during the ISIS periods in the war surgery. I'm traveling. I'll be traveling to Egypt shortly, in the beginning of July, and I was wondering if I can do volunteering, which I really interested because I contacted with all the Red Cross, which is available in Iraq, and they do not provide any service in Gaza. I was wondering if I could apply through your medical organization. Thank you.
Yes, you can. I just sent you my email, and you reach out to me, please, and we'll get you the links on how to apply for future missions. Yeah, thank you very much.
Thank you.
Sure. Next is Jamal Mustafa.
Thank you so much. Thank you for taking my question. I am a general surgeon and trauma surgeon and a surgical intensivist in Michigan and also in Florida. I just have a couple of questions. I've been putting my name on the list for quite some time, but I haven't heard any about regarding my ability to contribute, which I really would like to do that. And my question is the limiting factor is the ceasefire decision is a limiting factor? And if this is the case, do we anticipate that things will open up a lot more when there is ceasefire? That's number one. Number two is I hope we all pray, of course, that there will be a building up of Gaza and things will hopefully, take time, but at least it will start. Will there be any ability for us to have a long-term relationship with the place in terms of being in the operating room and also training and teaching residents and all this? Thank you.
Well, thank you, Dr. Mustafa. I mean, this is a logistic question to PAMA, so I'll take it. The limiting factor for sending more people to Gaza is what we are allowed to send through the WHO. To give you an example, we had a mission that is supposed to go June 24, and that mission is made of 14 people because they told us you only can have 10 people to go to Gaza. So I put 4 extra in case some will cancel. So now they are telling us that it might be 3 or 5 people. And they are telling us those 3 or 5 people, they need to stay for 4 weeks. And I recruited people to stay for 2 weeks. That's what their previous rules were. So they want to stay, everyone to stay for 4 weeks. That's another limiting factor. And they also limiting what we can take medical supplies. And it's not that the WHO is restricting. The Karim Abu Salim crossing is restricting them, and they are backed up and they're restricting us. So all goes back to the crossings that they need to open, and we need to deliver more humanitarian aid to Gaza. Things were better at the Rafah crossing, but we were still complaining at the days of Rafah crossing that we need to send more people to Gaza. So the whole thing is manufactured, is man-made. We need just to open Gaza to humanitarian aids. That's what we've been asking for and lobbying for. But yeah, thank you, Dr. Mustafa. I have your name, Dr. Gamal Mustafa, I know, and we'll get to you, inshallah, one day. Thank you very much.
Thank you. Thank you so much. Thank you so much. I appreciate it. Please let me know. You have my cell number and my email. Thank you.
Thank you.
I'm
sorry, I thought he was done talking, so I disabled him to talk. So before I keep moving with the questions, there was a question from Sarah Al-Ghalban, and I want to give our panelists time to reflect on it before we get to the end of our session. I'm going to read the question to all of you. She says, I would love to hear from the panelists about how it has been since they returned. I can only imagine the first and second hand trauma that they have had witnessed. How has the process of reintegrating back into the US life, how have they been able to take care of themselves and process their experience? So I think I know, like I've talked to some of you who came back from Gaza before. It takes you a day, a week, a month, and even more to realize what you have went through. But I'm gonna take that from you at this point in time. I'm gonna start with you, Dr. Abdel Fattah. How was it since you came back and knowing what you know about Gaza now?
I mean, to be honest with you, it's very difficult just coming and seeing the calm, comfort, the blessed life that we all have here. You know, just and realizing that nothing changed for them. The bombs are still stopping. I'm still getting messages from the physicians there. They're intubating kids. And so that's hard to accept. And so I've been trying to sort of process it by staying active in the cause for Gaza, whether, you know, talking about sharing their stories that we saw or encouraging other physicians to go and volunteer because they need all of us now. So I know everyone's eager and signing up. So continue to just wait patiently because hopefully you'll get that opportunity to go. And I want you to just encourage everyone else to continue to sign up to try to go because they need us. Meanwhile, additionally, just advocating for them, like my other colleagues have stated, never underestimate your efforts. You know, multiple people in Gaza came up to me and said one of the few things that's giving them hope are the protests in America. And they were specifically talking about the student protests. But, you know, so just continue to be talking about their story, calling your representatives. We've been doing everything that we can, and we're going to continue. We're meeting with our congressmen. Hopefully, Dr. Hamad will be meeting with some congressmen and senators next week. And so we're going to keep pushing from our end, but it needs every single one of us. Everyone has a role to play, and it's up to you to figure out what that role is. So that has helped me process it. It's still taking me time. Talking to my colleagues has helped. And I just hope that everyone continues their efforts.
Thank you, Dr. Abdel Fattah. Who want to take it next? You guys jump in. Dr. Jumana, maybe?
Okay. You want to go, Ghada?
Okay. I would like to mention that you know, the energy that we had when we went to Gaza, the energy that we had, the fire in our heart to help people over there. The one thing that we ask our families, I believe all of us, please pray for us to be able to stay 24 hours working without sleep because we really want to help. And when we went there and we saw the people and the hope and the love and the happiness that they have and the strength and the resilience make us even want to help even more. So when we came back, we all know what's going on from the news, from everything. But of course, when you live with them, it's totally different than when you're here. So when we come back, I don't think that any of us honestly have a trauma because we know what's happening. But now we have more responsibilities and the right that we have for them, the duty that we have for them to keep our advocacy with them. I don't know how many interviews, how many when I'm talking with, I already did 2 letters to 2 different senators in New Jersey, one in Paramus and the other one in Booker. So we have a lot of duties that we have to do for them, and we are able to balance. You know, our life is still the same. Our kids in the school and they're playing and having fun. Our work is there. Our pharmacies, our hospital clinics is still going on. Our husbands or wives. So I don't feel that there is any kind of complexity or conflict that we have. But now we have more duty, and I feel the energy that we have when we come back is way more than we used to have, because before we left, we wanted to help. How we can help? We're going to give them money, we're going to send, we're going to talk, we're going to go protest. But now we already witnessed, so people want to listen to us. And if we don't do this part, that's mean we are doing something wrong with our God. So because we witness, even if it's going to be 5 minutes, even if it's going to be 2 minutes, it's our duty to do that. It's their right to do that. They told us only one thing. By the way, they don't need our money. As I mentioned at the beginning, maybe they have nothing, but they have everything. And we think that we have everything in this life, but honestly, we truly have nothing. They don't need our money. You heard that they have no resources, or it's very limited resources, let's say. The knowledge that they have, I'm not going to say more than us, but yes, they have a lot of knowledge. They need the hope. When they only saw the vest that we are wearing, the kids and the adults, they tell us, This is the hope. Because you have this, that means we will not be killed. They need your prayers, dua. They need, of course, what is it called? مساعدتهم. I forgot the word. They need their voice. They need your voice. This is what they need. So I feel and I believe everyone in my team, we have the same thing. We've been texting each other, sending the pictures. We still live with them. We chat with them on the WhatsApp. Now we have another family. At the beginning, we have our families in US, but now we have two big families. Our families in US and we have our family in Palestine. So I encourage everyone, hopefully, the things will be different. It will not stay the same. Things change all the time. This is the life. It's a journey. Write your name, send your email to PAMA. It's amazing. I'm not saying this because I went with them, but honestly, it's an honor to be with PAMA. Write your name. One day you will be in the list and you're going to go and you're going to serve. But there is no any conflict, no any kind of mental health difference. We are the same. We are happy. And it's our part. Yeah, it's our duty to do that.
Thank you, Dr. Ghada. Thank you. Dr. Jumana, you're next. How you been doing and dealing with what you've seen in Gaza and reconnecting with our normal life in the US here?
Actually, for me, it's been difficult. I'm just leaving. I mean, lots of sleepless nights and crying. I miss everybody there, and I made so many connections. And like Ghada said, we're on WhatsApp 24 hours a day. We keep texting. They ask me about cases. But yeah, lots of crying. I dream every night that I'm there. But that did not prevent me, like Ghada said, from doing my part. So as soon as I got here, the next day I was giving a speech at a masjid, and the next day I was in a protest, and the next day I was giving a lecture in Columbus, and the next day lecture in Toledo, and then yesterday we had a huge parade, citywide parade that we were represented there, and we had a huge presence. So I did not stop my advocacy, but at the same time, I am struggling because I miss all those people, the beautiful people.
Yep. Thank you, Dr. Jumana. Dr. Hamawi, how you've been dealing with everything you've done in Gaza? You've seen the injuries, you've seen the trauma, you did what you can. Now you are back in the US. How have you been dealing with all of this?
So if you don't come back unchanged, I don't know what's going to change you. So it does impact you. And with healthcare professionals, we see sick people, we see people, like we're with people when they die, we see them at the worst times in their life. But this is beyond that, and I think we felt good when we were there because we felt that we were actually doing something. And alhamdulillah, I think all of us, when we've come back, we have been we went there and we wanted to go there, and someone said and we were happy when we got there and we were working. But when you come back, you realize how much more you can do and how much more that we are doing right now is, again, something that everyone could be doing. Yes, people want to hear what we've seen, but I don't think we're telling you anything that you don't know. We've seen this on social media. We've seen more horrible pictures than we've shown you. We've heard all the horrible stories. So we're not giving you any more information that you don't know already. And we are all more active in advocating, I think, because we've experienced that, but that's really not a requirement. And I know I've been you come back, you're very tired, you're fatigued, you got all the exhaustion kind of like that you've accumulated, and plus the time change that's on top of you. But you get up, you make the phone calls, you have the meetings, you participate, and as I mentioned before, this is something that everyone can be doing. You don't have to go there to do that, and that is making a difference. And when we were there, and when we couldn't get out and everyone advocated. You were doing that, and I think you need to continue doing that. And this is, I think that's how it's changed me, is to realize how little I was doing before, even though I thought I was doing a lot. You know, I was going to demonstrations, but I could be doing more, and everyone can be doing more. And like Dr. Muhammad said, is that it's all up to us to look at what we're doing and increase that. Like, we all know what we can do. We all have skills, and you don't have to be in healthcare. If you're a writer, write. If you're an artist, draw. If you're like a lawyer, then, you know, start lawyering up. And like, we need everyone to do what they are good at, and we need them to do more of what they're doing right now, because whatever you're doing right now, it's nothing compared to what they're doing over there. And that's what we witnessed, is when we go there, is what are they suffering through? What are they doing? What were we able to do while we're physically there? And I think our jobs as witnesses is to come and tell you that, and tell you what we saw, and to tell you that you're not doing enough. If you think you're doing enough, you're not doing enough.
Yes, indeed, Dr. Hamawi. Thank you very much. I'm going to take 2 more questions from the people who raised their hands, and Dr. Mustafa is going to screen through the questions in the chat to see. I think there's one question, Dr. Hamawi will come back to it, and a few more questions, but I'll let Dr. Mustafa choose those, and I'll give him the closing comments, and we should be good for the day. But Zubair Rasul, go ahead and unmute yourself.
Hello, everyone. I'm Zubair Rasul. I'm an MBBS graduate from Kashmir, India. Actually, I have raised my question earlier in the comment section, but I haven't received any response over there. So first of all, it's extremely disheartening to witness all these atrocities and sufferings of our beloved brothers and sisters in Palestine, especially Gaza. And what's more depressing is our absolute helplessness in the face of this tyranny. And for my deepest condolences to all those who have lost their loved ones, and hope and pray for the better times ahead. I want to ask if I can volunteer and be helpful on any medic mission to Gaza. Thanks.
Yes, you can volunteer, and we'll make sure you have the link to submit and sign up your application. Dr. Mustafa, was there any other parts of this question I did not pay attention to? Like, Zubair, any other specific questions? Did I answer? Is that the only thing?
No, it's the only thing. Actually, I'm from Kashmir, India, and as I've seen all the attendees here, they were from either they were in USA or Canada, but I am from Kashmir, India, and currently I am in Kashmir.
I got you.
So I just want to ask if I can volunteer and be helpful, on any medical mission.
The passport it can be a limitation, unfortunately. But when we were going through Rafah, I'm aware of Pakistani and Indian passports went through. Now the Karam Abu Salim is a totally new game, and there's different rules, and we are still figuring it out. So I can't answer the question, but I assume you have an Indian passport, and that might be allowed. We'll inquire about that. We'll get back with you.
Okay, thank you so much.
Okay, thank you very much. Thank you. Next is Nordine. Please unmute yourself and ask your question.
Halo, Assalamualaikum warahmatullahi wabarakatuh.
Alaikum salam. Go ahead.
Okay. Thank you very much for opportunity to attend this webinar, and also thank you very much for opportunity to have the question to all of the doctor and Palestinian Medical Doctor Association. So I'm from Indonesia. Actually, I'm very happy. Actually, I want to join with the medical team travel to Gaza, right? As my experience before, I worked at United Nations Hospital in Ghana under WHO. So at that time, our support with the WHO. maybe my suggestion that maybe you also can work together with WHO, then more resources you can send to Ghana. And another question is, I already applied, actually I applied last 3 months ago for this opportunity, but until now I didn't get any response. Maybe I hope I can also with the medical team to Gaza. Thank you so much.
Yeah, thank you, Nordine. Yes, we are collaborating with WHO. That's what how we are doing our work in Gaza. And yes, we have your name, we have your email, but we will need to get to you and many others. As I said, the rate limiting step is the crossings across Gaza. They are not allowing enough humanitarian aid. So once things open up again, we will be able to send more people and we will get to you, inshallah, one day. Thank you very much. Thank you. Next is thank you, Munir Sharafi, and then after that we'll give it to Dr. Muslah to take over. Munir Sharafi, go ahead.
Assalamu alaikum wa rahmatullahi wa barakatuh. Jazakumullah khair for everything you guys are doing. My question is, and this may have already been answered, so I apologize. But is there another way or some different strategies we can take to come up with ways to get around the restrictions? Like, for example, if we can go to the West Bank, if we can have some volunteers to go there, send a team there, or send a team in Egypt close to the border, or send some people like in Nablus or anywhere in the West Bank, maybe anywhere in Jordan. I mean, I'm just trying to think of ways to beat them at their own game, instead of waiting. And then I know I'm not minimizing the waiting and the other things that we're doing, but is there any strategies that we can brainstorm and come up with? Jazakallah.
Dr. Mustafa, I want to take that and take it from there. Take the question.
Can you answer that? I was busy and
no
questions and I didn't.
So I mean, the idea is noble and is beautiful, is to send medical missions around Gaza, West Bank, Jordan, Egypt. Yes, that will help, and there are medical missions there, and there are hospitals there waiting for people to get out of Gaza to help them. But the problem, people are in Gaza. The ones who need help are inside Gaza, and there is no way to help them but to go in Gaza. And that's what we are trying to do. So being around Gaza is under complete siege. And the people of Gaza cannot, even the wounded, cannot leave Gaza for medical care. So the only way to help at this point in time is to go inside Gaza and help them, while still efforts are ongoing to get some of the wounded out of Gaza. But we are not getting out those who need to get out. Like, it's a very small percentage of those who need to get out to get the medical care they need are really getting out. So yeah, so to answer your question, unfortunately, there's no way around it but to go in Gaza and help them. But yeah, thank you for your question, Munir. Okay, Dr. Mustafa, go ahead.
Sure, thank you very much for great questions. We have way too many questions. I've been trying, me and Dr. Majdi, to answer many of those. I think we have answered 74 questions. There are 43 open, so I don't know if we can get through all of them. But I will ask about a couple here, I think, that I think helpful. So there's a question about whether or not we go to other places in Gaza, or is it only in Rafah? For the medical missions, as we mentioned, we try to go to one place. Now we actually have explored, and the north part, of course, was completely closed for some time. And recently, before this takeover of Rafah, the teams were allowed to go there. There are a lot of logistical issues, and we were actually planning to have some sort of evaluation to do that, and we have plans to go there for a logistic team, but then things changed. But we do have plans to launch outreach clinics and primary care, and which is another question people ask. primary care and medical specialty outreach mobile clinics in the north of Gaza, which will be launched very soon. We currently have 3 medical points with a partner organization also that we're working with them, and we're sponsoring the work. And we have a wound care clinic in the European Hospital. There was a question for Dr. Hamawi. As far as you know, are there enough local surgeons to carry on surgeries after your team left? And as a general surgeon, what was the scope of procedures that you have performed? Maybe we can answer, Dr. Hamawi, the first part of that question, because I think the second part has been to some, or you can go over that a little bit also if you want.
So there were not enough surgeons there, and that was for several reasons. They've been slowly depleted over the last 8 months. Many of the surgeons that I did work with at the European Hospital had actually been they're refugees themselves, so they had fled from the north. So they initially started up north in Gaza City, and then were at Shifa Hospital. Many of them went to other locations and then finally landed up there. Same thing with there was people there that were at Nasser Hospital that made it down, and that being said, there was many that did not make it. So there were many doctors that were killed along the way, and nurses. There's many that have been taken and have been disappeared. They've been in prison, and we don't know what's happened to them. And those that were at the hospital were those that remained there, because there's many that are with their families, that are refugees, that are living in tents and have made the decision that the right thing for them is to take care of, you know, their immediate family members and not stay at the hospital. And I can't fault them for that decision as well. So there is a severe shortage of surgeons of all specialties. When I was there, I knew of really only one plastic surgeon that was a fully trained plastic surgeon that was in the region. The one that I was working with in the hospital was a general surgeon who has decided since October to take up plastic surgery. So he's just learning by experience and with working with other plastic surgeons in the past. And that's who I left behind at the hospital. For general surgeons, their scope of practice, because we had some on our team that left and there are a few that remain there, is the scope of general surgery. So, you know, abdominal wounds that are penetrating abdominal wounds that are coming in every day, plus, you know, your bread and butter. I mean, they were doing hernia repairs, they were doing appendectomies, they were doing gallbladders. You know, that's kind of been overwhelmed with a lot of penetrating abdominal injuries as well. So, yeah, that's the current situation.
Well, thank you very much for sharing that. A quick question also, this is, can you share, I will probably let that to Dr. Abdel Fattah, share about how to cope with the sense of unsafety or the risk of abduction, risk of injury, and risk of death, since there have been targets on healthcare personnel directly in Gaza. Can you share how you felt there, and what are those, you know, concerns and fears, and of course, you know, they're legitimate concerns that some people may have, but let us know how you felt before and after and during.
So before I left, there were some webinars hosted by PAMA with previous physicians that went, and some stated that they felt so safe in the hospital. It was hard for me to understand that, but when I was there, that's truly how I felt. I felt detached from what was happening around me. I mean, yes, you hear the bombings, you hear the drones, but as far as personal safety, I didn't feel at risk while I was there. And I'm not sure if that's because of the local staff. You know, they're just so in the groove of living in a war zone that they make you feel safe. Additionally, you know, I didn't see any direct harm to our staff while we were there. But at the same time, I'll tell you, we were there when the UN aid convoy that was traveling to EGH got hit, and there was an Indian national that was killed. And we were actually in the ER and treating the passenger, a Jordanian national. So that's when it got pretty real for me that, you know, we're still at risk being here. There always is a risk of harm to us. So yeah, that risk is there. But I'll tell you, PAMA, I know for a fact it was coordinating with all the authorities constantly, daily, and making them well aware that foreign nationals are in the hospital and doing everything that they can to protect us. And so personally, I felt safe. Maybe it was a false sense of security. Yeah, there are risks involved. And that's what I have to say.
Sure. And I want to add here that this is, of course, we as an organization, we do our best to ensure safety of our teams, but we also make sure that, and I think it's very clear, we share with our teams and the people who are willing to volunteer. People are going, this is a war zone, and a war zone with a lot of not much respect for a lot of you know, laws and humanitarian you know, situations, unfortunately. And there is, of course, a risk, but we collaborate and coordinate with the WHO, who coordinate with all authorities. So they deconflict our team locations and everything. And, you know, even with that in mind, we understand that there's a risk, and the people who go, they're true heroes, because they're putting their life at risk. You know, they're putting their safety at risk to go and deliver you know, health care and provide aid to the people of Gaza. So that's very commendable, and we really appreciate all what you did for that. Question about there's okay, so there's questions about who can go to Gaza if they have no U.S. citizenship. That is not necessarily a requirement, but if you have, there are some limitations maybe on, during Rafah, when we went through Rafah, there was less limitation, I would say. Now it seems like there might be more limitations on some nationalities. But most people who have, I would say, a foreign passport, they should be able to get in. We have people from the Gulf countries who came with us. There was a specific question about that. There were a lot of Jordanians and a lot of people from the Middle East without U.S. passport who also were able to go in. So it is not like, if you're a Palestinian citizen, ironically though, you cannot go in if you don't have a foreign passport. So that's probably the major limitation. A question about, was there any reaction from your employer and your colleagues after you came back? I think maybe Dr. Jumana can answer part of that. And I don't know, it may be different in different settings and different employers and different work environments. But Dr. Jumana, if you can share what's your reaction from your colleagues, and if anyone has any kind of something about that to say.
Well, I haven't been back to work yet, but while I was there, my manager was sending me messages almost every day, making sure that I'm good and praying for me. So far it's been good, but I haven't been back to work yet. I was supposed to be traveling to Jordan today, but I canceled my trip, so I'm off for a month.
I think, you know, for the most part, I've not had any feedback from any of our volunteers that they have problems, you know, from their employers that they're going. And actually, some of the employers for other volunteers, they donated supplies to our team and our mission, and they were supportive of that. I know for a fact that when the team was delayed, I have personally reached out to some of the supervisors for, you know, at least one of our doctors here who requested us to reach, because they were delayed and he was supposed to be back on shift. And I don't know, I mean, we just had some communication, and I was saying they asked for like a, you know, documentation that to prove that, but that's about it pretty much. I didn't hear any kind of negative reaction, but of course, you know, you're you should probably reach out to your employer if you go to a medical mission and make sure that they're okay with you leaving and all that stuff. I think there's a lot of questions. I don't think we can go. I don't know, Dr. Majdi, what do you think? We have been almost.
No, I think we want to call it a day. I think our panelists have been very generous to stay 43 minutes more. So I think we answered most of the questions. I managed to answer like 96 total now between you and me on the comments, and 24 are left not answered. We'll try to get to them. But no, I want to say thank you, our panelists. Thank you for all who attended the webinar. This will be recorded. We will put it on YouTube so you can share it with others who might have been interested to join. And Dr. Mustafa, I'll give you the final comments.
Yes, thank you very much. Big thanks to our panelists for being in Gaza and coming back and continuing to do the great work that you're doing. I feel every time we send a team to Gaza, we have a massive energy coming back because that amplifies pretty much their work, and they've been around and reaching out to knocking on all doors, and that is very great. And we encourage everyone here also to do the same. We can't stop. We cannot, give up, and we cannot even slow down. So we need to increase our efforts, increase the advocacy, keep pushing on our asks and messages, and try to ask for a just treatment, and we need to have medical aid, humanitarian aid to get in, and we need to have a stop of this very bad situation. Thank you very much for joining us, for all the participants. I think we had a very successful show rate, and if we apologize for not answering the few questions, but this will be recorded. We will share it in our social media, and also we will share it with you through emails, whoever signed up for this meeting, and the people who couldn't make it, they also will be able to find it, and it will be on our YouTube channel. We appreciate you all. Thank you very much, and have a good weekend.
Thank you all. Thank you.
Thank you.